My name is Tarik Benidir. I'm a urologic oncologist at the University of Florida, and I'm the director of the Prostate Cancer Advisory Council of Florida. So I'm originally Canadian, so I went to medical school in Ontario. It's called Queen's University. After medical school, I went to University of Toronto, and that was for a residency in urology. And I did a urologic oncology fellowship at the Cleveland Clinic. My clinical interests are in urologic cancers. So specifically, I do kidney, bladder, and prostate cancer. I have a large clinical interest in prostate cancer because of my research background. Specifically, I really enjoy trying to better understand patient selection for focal therapy. I think focal therapy is a new modality of care. It's treating part of the prostate that has disease while leaving the other part that doesn't have disease untouched. And so by virtue of that, you minimize the side effect profile of treating the whole prostate. And so there's several different ways of doing this, both heat conducting and not heat conducting. And I'm really interested in being able to offer both. So those are main clinical interests. But in line with that, I also like doing robotic surgeries for bladder cancer, kidney cancer, and prostate cancer. It really spans the realm of prostate cancer and bladder cancer. And so kind of the way I like to think about prostate cancer is there's really three silos. It's the DNA of the patient, the genomics of the patient, and then that leads to the tissue, the histology of the patient. And then afterwards we have what we see on imaging. And this is when the patient comes in and he has an MRI or he has a PET scan or a CT scan. And so these are three silos that we utilize, but they're all different. And so something that I'm really interested in is, can we utilize things in the DNA and the genomics to predict early on what's going to happen in the tissue and early on what's going to happen in the imaging? So we can kind of make really important decisions before they show up too late on imaging. So I really want my patients to understand what their disease is, and I really want them to make a decision that's best suited for them. You know, as a urologic oncologist, I understand prostate cancer, bladder cancer, whatever cancer you want to bring forward, but I've just met the patient, and I really, don't know them personally as well at the first meeting. And so my hope is that I give them enough information that I really demystify what it is to have cancer and where their cancer stands in the realm of different types. And then once they have that information, and they have that information about side effect profile, advantages, disadvantages of treating or not treating, or how to treat, they make the decision that's best for them. So the way I treat patients is I really give them the most information to make the best decision for themselves.